Welcome back to Bloom. In today's Daily Dose, we're getting a good dose of the importance of oral health. Joining us to discuss oral health and the top oral trends of 2019 is registered dental hygienist Anastasia Turchetta. Welcome, Anastasia.
Thank you.
Now, you and I know that oral care is so important, but it is something people don't always attend to, but you are in it. So what are some of the top trends we're seeing in oral care for 2019?
First of all, thank you for having me here. Yeah. This is exciting to actually share that our mouth is attached to our entire body.
Is it? Yeah.
I mean, it's amazing how people just, they seem to disconnect that the mouth doesn't have a place, but the bacteria does not stay focused, as our teeth don't, I mean, our food does not stay in the mouth.
There's a digestive tract.
It's there to feed and fuel the body. Yeah. Exactly. So some of the trends I'm super excited about are preterm, preterm birth and how that's related to what the mother can do. So not only is she eating for two, but she's smiling for two, if you will.
Okay.
Another hot topic is heart disease and diabetes. Yep. That seems to be one that's one every year to educate individuals. Another one is actually HPV and its relation to oral cancer, and how the dental professional can start the communication and introduce with the parent at least the importance of vaccination. And this is for protection in not only for girls for cervical cancer, but in boys for oral cancer because it's a sexually transmitted disease. Vaping, hot topic. Yeah. There's oral side effects. Then finally, it affects our self-esteem.
Okay, so you said pregnancy and mom smiling. What does that do for the baby, and how does that relate?
It's interesting. So like a lot of individuals think, and this, I don't know if it's a myth or not, like, you know how we had those like, do you do this or don't you do this?
Yes.
It's one of those things where sometimes we're fearful of the dentist.
Yes.
So we don't want to go in and we don't want to harm the baby. However, if the mother has gum disease, and gum disease is where you're starting to lose bone, it's inflammation.
Yep.
I mean, as a nutritionist, you get this. So any inflammation is not good or healthy for the baby. That, in addition to other risk factors like preeclampsia, diabetes, that type of thing, can have the baby go preterm.
Okay.
So like look at March of Dimes, different things like that.
So just making sure that the oral care and the consistent care you put in before you're pregnant needs to be just as important while you're pregnant as well.
Correct. So staying on that, there was a recent study for vitamin D. And what was interesting is usually, I believe, and you can correct me on this, I think it's 400 IUs a day.
Yep.
So now there was a study where the women took more than 400 IUs of vitamin D. And that is actually helpful in making your enamel solid, which, so when the baby is born, the child's teeth does not have any enamel defects. That's a big deal.
Because the baby is born without teeth, but they've already started to form, even though you're not seeing them, and the mother is actually taking part of that. Wow, that's isn't it amazing how our body sort of all works together?
Yes.
I think another thing that we've definitely seen more of, but people who might not pay attention to dental care aren't as linked to, is the link with heart disease, as you mentioned.
Correct.
And our gums. So what should we be doing to make sure we're taking care of our teeth, to take care of our heart?
You need to know your risk factors for your lifestyle, actually. So, I mean, people, I think, to generalize, you've got the risk factors would be high blood pressure, high cholesterol, smoking. There's other lifestyle risk factors, and it could also be genetic. As far as what can you do for your oral health, you could say brushing and flossing, and I would fully agree with that. It's a health and wellness visit. If we get away from the stigma of cleaning, I think that would be beneficial. We should look for a dentist or hygienist that takes your blood pressure during the appointment.
I've never had that happen.
That's
wow. Okay.
It's key. It's simple to do, but if you can do it at other bigger stores, which if you can do that in other stores, then why are we as healthcare professionals not offering that for our patients?
Absolutely right.
The second thing to do is understand what toothbrush is beneficial for you, what toothpaste, what your oral hygiene regimen is. It's a fitness program. Like we were talking about running, this is exactly what it is. So you have to figure out, okay, what toothbrush, electric, okay, what toothpaste, what mouth rinse, and we can maintain gum disease. So if we're looking at heart disease, you're trying to maintain it, right? You're trying to not let it get worse.
Correct.
So the same thing is with your oral health. It's just a fitness program, and maybe if we looked at it that way, we might be able to switch gears and get on the health and wellness plan.
We've got to be thinking about this. I love how you have us thinking complete mind, body, starting from our mouth and our smile, which is important too. Quickly, what are resources people can go to if they'd like more information?
More information could be found at CDC. I've got a PDF together for people to go to if they want to. They can just visit the website.
Okay.
But the Center of Disease Control is obviously a great one, the National Institute of Health.
Okay. All right, well, thank you so much for all those great resources. We have a free PDF with links and resources, as we mentioned, available on our website, and her website is www.anastasiaturchetta.com. Thank you so much for helping us have bright smiles and bright health as well.
Thank you for having me here.